Okay, welcome back here for our third and final video for neuro. We are on page 369. And first, traumatic disorders, cerebral concussion and contusion. We really worry about injuries to the head here. The skull is going to protect that brain, but the brain can bounce around within that skull and get injured. So a contusion is actually a bruising to the brain, where a concussion is actual injury and can include a loss of consciousness or not, but there is damage to the brain with that. And unfortunately, we want to really be careful within the first like 7 to 14 days after injury. Re-injuring the brain is much more severe and could even be fatal. So with our sports and things like that, we want to be careful and follow concussion protocols to not have another re-injury shortly after the first one. With vascular disorders, a cerebral vascular accident, or CVA, is a very common abbreviation for that. The common word for this is a stroke. And this could be because a thrombotic or embolic event, which is a clot that is either formed in the brain or formed elsewhere and floats to the brain and blocks off the vessel. So you can see on that part on the left here where a clot has blocked off the blood flow to an area of the brain. Or here, thrombosis is just in the brain, some fatty plaque building up, forming a clot, slowing down the blood flow. Also could be hemorrhagic, that maybe because of high blood pressure, you have a bursting of a blood vessel in the brain. Either way, we're not going to be getting blood and oxygen supply to the brain tissue where it needs. It's going to be blocked or bleeding around that tissue. Here is a picture of a scan where we actually see some damage here to that, probably from a hemorrhage. So this is a stroke. Know that a stroke is a CVA, same difference there, cerebral vascular accident. Migraines are on page 370, and this is a severe headache, and it can be from varying blood flow to the brain. So sometimes it helps if they kind of control that. They may be very sensitive to light, photophobic. They may have an aura that tells them a migraine is coming on. Sometimes people that have seizures also have an aura as a sensation that the seizure is coming on. And then we're going to continue on to page 371 and some of the laboratory and clinical procedures here. So first, cerebral spinal fluid analysis. If we do a spinal tap where we draw some fluid off of the spinal column, some cerebral spinal fluid there, then we can analyze it or separate it apart into different tests to see if there's bacteria or viruses or different contaminants in there. Under clinical procedures, the X-ray test, cerebral angiography. So this is the process of recording vessels pertaining to the cerebrum or the brain. So those right and left hemispheres. So here you can see on the left the anatomy of the blood flow or the artery flow to the brain. And on the right is actually the cerebral angiography, the X-ray picture of that. And you can see where some of these numberings are, some narrowing of flow of the blood through those arteries, which could put them at risk then of having a stroke, cerebral vascular accident. Computed tomography on page 372, we've talked about in each chapter. So we take transverse cuts of X-rays, send them to a computer, and get our images that way. MRIs is using magnets, not the X-ray. So no X-ray use here, it's all by magnets, magnetic resonance imagery. There's also MRA, which is magnetic resonance angiography, recording the vessels with magnets. And on the right here you can see an MRI of the spine and the spinal cord going down there. MRIs do show soft tissue a little bit better than CT show the hard tissue of the bones a little bit better. Going into some radionuclear studies here, and those of you guys that are going into radiology will get in more depth with this, but PET scans, positive emission tomography, so a recording in transverse cuts using the positive emissions there. It looks at the metabolic activity of the cells, so they can actually, this is a PET scan of the brain, which have become very popular in the research with depression and some of our different mental behavioral disorders, and so ADHD as well. We can see the metabolic activity of the brain, and the different colors show you what parts of the brain are active. And so here they have the eyes closed versus the eyes open, versus maybe they have them look at a complex image or do a complex math problem, and they can see how your brain is metabolizing and active based on the different functions. Ultrasound then is using a transducer to record the sound waves and turn them beyond ultra into pictures. We've talked about those in other chapters. Here's a clicker question. What is the recording of the spinal canal or the spinal cord? And so is it electroencephalography? Is it PET scan? Is it myelography? Or is it SPECT, which is another type of specific radiology test, similar to PET but a little bit different? And the correct answer is myelography. So that is the process of recording the spinal cord. Electroencephalography, also known as an EEG. This is on page 373. We put these electrodes on the head to record the electrical activity of the brain. Do not confuse this with an ECG or an EKG, was the electrical activity of your heart. And you see on the left here normal EEG, the normal electrical activity of our brain, but when we're in a seizure, our brain is numerous times more electrical activity than normal. And so you can see those evoked potentials or those spikes on there. Okay, if we want to do an analysis of the cerebrospinal fluid, we might have to do a lumbar puncture. I was referring to that just a minute ago. And you have this picture on the top of 373. And so we will have the person kind of sit curving the spine that allows the vertebrae to spread a little bit more so that we can get in between them. And the anesthesiologist will go ahead and stick a needle into the area where the cerebrospinal fluid is, that subarachnoid space, and actually take a sample of cerebrospinal fluid out of there. So lumbar puncture, puncturing, putting that needle into the lumbosacral, lumbal area there, the lumbal spine, to get a sampling of the cerebrospinal fluid. Stereotactic radiosurgery, you have at the bottom of the page there. And this is a very specialized instrument that allows us to kind of get the X-ray beams exactly where we want it to be in the brain. And they actually will have a helmet sometimes that they'll put on, and the radio beams go precisely where they want, and we can do surgery with that. So a couple other things here I just want to expose you to. This I don't believe is in your book, but transcutaneous electrical nerve stimulation, or TENS units, people that have back pain especially. This is a little electronic device you can see there on the side, attached to electrodes and little like Band-Aid patches. And we send out electrical impulses to override our nervous system, to send messages to the brain to try to kind of confuse and override those pain stimuluses that the person may be experiencing. So people with chronic back pain may have a TENS unit. There is actually over-the-counter type devices of this, but pain management centers will use a little bit different, stronger devices with that. We didn't necessarily talk about this, but see if you know. Incision of a spinal cord to relieve pain. Is it a sympathectomy? Is it a cordotomy? Is it neurolysis? Or is it the TENS unit? And the correct answer is a cordotomy, making an incision, a tomy, into the cord, the spinal cord. And we can do that for severe chronic pain to try to cut those nerve responses from there. Your book does have some abbreviations on page 374. For the most part, I'm not too concerned about these, but I will expose you to a couple of the more common ones. AD for Alzheimer's disease. CNS we did talk about for central nervous system. CT we've talked about in every chapter, computed tomography. CSF for cerebral spinal fluid. CVA is very common for cerebral vascular accident, and I want you to know the other name for that is stroke. EEG, be careful you don't mix that up with ECG or EKG, electroencephalogram, as opposed to an electrocardiogram. Lumbar puncture, we talked about LP. MRA, magnetic resonance angiography, or MRI, magnetic resonance imagery, and that is using magnets instead of x-rays. Peripheral nervous system, PNS, we talked about the PET scans, positron emission tomography. If you're going into x-ray, that's going to be important. Transcutaneous electrical nerve stimulation, the TENS unit that I showed you the picture of. TIA is a transischemic attack. This is symptoms of a stroke or a CVA that resolve itself within 24 hours. And it's kind of a warning sign that you have some pathology going on there and you're at risk of a stroke, but that this time your body was able to maybe break down that clot or resolve things. So that brings us back to our focus here. Cauda equina, hopefully you remember what that is. That was the collection of nerves that look like a horse's tail from the bottom of the spinal cord. Dementia is a condition of being apart from the mind, and this is a problem with our thinking, our cognition, our memory. It could be a short-lived thing, maybe because of electrolytes off or toxicologies, or it could be a chronic thing like Alzheimer's. In the anatomy, the gyra and the sulci. The gyra were the folds or the hills. The sulci were the valleys or the grooves in the cerebrum of the brain. Synapse was that space in between the two neurons where the neurotransmitters, the dopamine, the acetylcholine, helped transmit that message from one neuron to another. Anesthesia is a condition without feeling. Aphasia is a condition of no speech, as opposed to aphasia with a G is a condition of no swallowing. There's also dysphagia and dysphagia. Ataxia is a condition of no coordination, not to be confused with apraxia, which was a condition of no purposeful movement. Dyslexia is an abnormal condition of words where it's usually a problem with both reading, writing, or learning with words. Don't mix up your plesias and your paresis. Plesia is paralysis, paresis is weakness, and we had hemiplegia or paresis, hemi being the right or left side, para, which meant lower extremities, plesia paralyzed, or paresis weak. We had diplegia, which was the same extremity on both sides, like both arms. We had monoplegia, which was paralysis of one extremity, and quadriplegia, which was paralysis of four extremities and a trunk. Paresthesia is a condition of abnormal feeling, and that abnormal feeling is specifically the numbness, pins and needles feeling, like when a limb falls asleep. Causalgia was the burning sensation of burning pain. Syncope is to faint or to pass out. So hopefully that gets you through your neuro chapter. Sorry, the videos can be a little bit long. If you have any questions or anything, please email me and I'll let you know. Make sure you work through those green words in the book as well, because that will really give you practice on there. So that was back on like page 357 through 362. Thank you so much, and I'm glad that we were all safe this week.